thank you for asking me to come talk with you today. I'm delighted to be able to do so. And I'm speaking, and I'm essentially giving you a presentation that I gave to the Otis, uh, who is the Organization of Teratology Information Specialists, a couple of weeks ago. And Dr. Jones asked me to talk with you all. So if you have any questions, feel free to bring them up, and I'll be happy to explain things if I'm not clear. This is really about alcohol-affected adults' self-reported health and mental health status. And I do want to acknowledge that about a zillion people funded us, including National Institute of Alcoholism and Alcohol Abuse and the Georgia Department of Behavioral Health and Developmental Disabilities, and the University of Washington School of Medicine, and the Ann Streiskuth Endowed Professorship, and the SKK Foundation, because it's impossible to do this kind of research without bunches of people helping. And here are a lot of the people who collaborated in the study. And essentially, we're talking about people from Emory University, University of Washington School of Medicine, and the University of British Columbia. And I also want to particularly thank all of the people in this study who have participated with us. And when I get into it, you'll see what a huge amount of participation that really is. The problem that we were trying to investigate is the following. Despite the prevalence of FASD and its lifelong course, which I'm sure you're more aware than I am, there is very little empirical research about long-term adult health, physical characteristics, neurobehavioral adaptive functioning. And we have a lot of rumor and a lot of anecdotal stories, but we don't have any real research. And there's a theory called the developmental origins of health and disease hypothesis. And it suggests that there's such a thing as fetal programming. Things that happen in utero have long-term effects. And we know that since prenatal alcohol exposure has such an important and noticeable effect early in life, it really ought to have a long-term effect. What we believe is going on is that it causes vulnerability in the organism, which makes it more sensitive to stress as time goes on. And we think that probably we should begin to see the effect of all of this in midlife. And in our study, what we did was this. We have a multi-site collaborative study, which is part of the CFASD program, which probably all of you in California are aware of. We had sites that included Atlanta, Seattle, Washington, and then there was a parallel study which was ongoing in Vancouver, which I'm not going to discuss the data from. And we had two-tier assessment in Seattle and Atlanta. In tier one, we did a demographic survey, a health survey, and created a registry for patients. In tier two, we did an in-depth assessment of medical records, physical characteristics, immune function, mental health, cognitive function, and social adaptive functioning. And I think one of the important things to understand is who were we looking at? In Seattle and Atlanta, the individuals were recruited from those who took part in earlier longitudinal studies at the University of Washington and at Emory. And in Seattle, there were a total of 475 individuals who, when we saw them at this particular time, were ages 30 to 74, predominantly white, with a number of people who were of Native background. They had been diagnosed with FAS, and 63% were non-dysmorphic but affected, and they were classified as having what was then called FAE. The others had FAS, and then there's a group of people who were seen as controls, who were non-exposed. In Atlanta, we had a total of 427 individuals in our pool who were in their late 30s when we came back to them. They're now in their early 40s. They were low SES, predominantly African American. And of these, about 300 were recruited prenatally from the same inner city hospital. And 70% of those people were alcohol exposed. And I bring up all of this because one of the questions that comes up in much research when we're talking about using clinical samples to study this is how do we know what the exposure really was? And in these cases, we really know what the exposure really was. We know that they were exposed because the mothers told us they were, and we've been able to follow them over time. When we went back to them after essentially 40 years, um, we had we gave them an adult health survey to look at chronic medical problems in midlife and access to health care. We were interested in a whole range of health issues, and these included whether or not they had access to health care. We wanted to look at their sleep, their vision, hearing, and dental issues, allergies and asthma, cardiovascular issues, GI issues, diabetes, and other endocrine problems, autoimmune disorders, arthritis, seizures, number of mental health issues, other mental health medical problems. And we also wanted to look at adverse childhood experiences, which they may have experienced. We based our questionnaire on the CDC behavioral risk factor surveillance system. However, it did not include everything we wanted in it. So we selected those things which were useful to us and then added modules on seizures, from a neurological questionnaire, and created modules on vision, hearing, and dental health, gastrointestinal issues, and immunology. This is the characteristics of those people who agreed to participate. And at the time we did this, there were 358 people who have, from this pool of people who had agreed to come back and answer the questionnaires. And as you can see, we have broken it up into those people in the contrast group who were not exposed to alcohol, those people who were alcohol exposed but did not have the full syndrome, which you would call FASD, and people who were dysmorphic, essentially, or were diagnosed with FAS. And we looked at their age, which was all around 40, late 30s, early 40s, predominantly female, really. We tend to find females are more compliant with this kind of follow-up stuff. There was a really interesting distribution of ethnicity and race, with a great many people, about 40% white, about slightly less African American, Native Americans, and other who were typically mixed race. We looked at their social class and found that those people who were alcohol exposed were tending to report themselves to be of lower SES, which is based on education and job status. Now, I would like to point out that at the time these people were identified, originally they were all of the same social status. So what we see here is those people who are FAS are falling into a lower social status as time goes on. There's also a real discrepancy in terms of marital status, with those people who are alcohol affected tending not to be married or partnered. But however, they had the same number of biological children, and those people who were alcohol affected had lower incomes. So you can see there are a number of social factors that are entering into what we're looking at here. The alcohol affected individuals are less often married, have lower SES, and lower incomes than the contrast group. We asked them if they thought of themselves as in good physical and mental health. And typically, those people who were alcohol affected reported they were in less good physical health and mental health than did those people who were in the contrast group. And then we asked specific areas of problems. And I can't really go over in the time we have all of the areas, but I've selected some that are of interest. Everybody reported needing glasses, basically. So that didn't turn out to be a useful thing to ask. We did see more problems in hearing among those people who were alcohol exposed. We found that those people who were alcohol exposed reported much more dental problems and much more loss of teeth than did the people who were in the control group. When we ask about health problems as a child and currently, those people who were alcohol affected tended to have slightly more problems with their heart as a child, but by the time they are around 40, they are beginning to report a higher incidence of cardiovascular problems, but they aren't reporting more high blood pressure. When we ask about gastrointestinal issues, we're getting a lot more problems with what they call heartburn, which may be reflux among people with alcohol effects. And they are reporting a great many more bowel problems or GI problems. I was not really expecting this, but we have a lot more urinary and kidney stone problems among those people who are alcohol affected. They report more kidney stones, they report more bladder infections, and they have a much higher rate of incontinence or inability to control urine than do the people in the control group. We also ask about endocrine problems, and two are represented here, thyroid problems and diabetes. There's a slightly higher incidence of diabetes among those with FAS, and there's a much higher rate of thyroid disorders among people who are alcohol exposed. We ask if anyone in the medical profession has ever diagnosed you as having allergies. And again, apparently everyone has allergies. There is a higher rate of skin problems among those who are alcohol affected. And these people, these are things like eczema and things of that sort. And autoimmune problems are not achieving significant differences at this time. One of the things that struck me quite strongly was we asked, have you ever had cancer? And we find that those people who are alcohol affected, but not necessarily FASD, report a higher incidence of cancer problems. And when you do a relative risk of cancer in the alcohol group, it is 5.43 relative risk versus 1 for the control group. So you're beginning to see a higher rate of cancer in this group. Another question we ask, has a medical professional ever diagnosed seizure disorder? And again, we have a much higher rate of seizure disorder among the alcohol exposed groups. When we ask about mental health, we ask about a number of different mental health disorders, including ADHD, depression, bipolar disorder, anxiety disorders, and psychotic disorders. And with the exception of psychotic disorders, the alcohol exposed group reports significantly higher rates of being diagnosed with mental health disorders. And you can see from the bars here that almost 50% of the people in the alcohol affected group are reporting depression. Anxiety is extremely high rates as well in this group. Now, these are disorders which are relatively high in the whole population, but as you can see in the contrast group, it is much lower. If you're interested in this particular finding, we have recently published a paper about it in February of this year in Alcoholism Journal, which breaks this all down in more detail. So one of the questions raised by these findings is, how can we understand these outcomes? Are we really saying that prenatal alcohol exposure is a direct cause of all these negative health and mental health outcomes? Are we saying that prenatal alcohol exposure is simply associated with health and mental health outcomes and many other factors might be involved? Is it one of many factors that affect the outcomes in these individuals? But these are questions for the scientist and ultimately for those people who want to treat individuals with alcohol effects. However, when you are looking at the individual, they're in your office, or if you are working with an individual who's alcohol affected, the fact is that they do have a higher incidence of these disorders. So what is the relationship between alcohol exposure and health and mental health outcomes? And this is a hypothetical set of factors which may be contributing to things. And we're talking about people at midlife. These are people who are about 40 years old. So there are a whole lot of things that have happened to them in life. And some of them may have experienced much more stress in their life due to lower SES, lower socioeconomic status, factors related to their ethnic group or their racial group, whether or not they had access to health care. For instance, the people in the sample that I work with are predominantly African American. They have limited access to health care, and they are obviously, for many of these reasons, under more social stress than other groups. All of this is related, of course, to maternal substance use and to prenatal exposure. There are also familial or genetic factors which may contribute to outcome. There are postnatal environmental factors and life experience, and all of these things can contribute to all of these health outcomes. So the next thing I did was try to figure out, how do these things all relate? One of the things I mentioned earlier that we looked at when we did our questionnaire was adverse childhood experiences. And among these individuals who responded, as you'll see on the right side of the slide, there's a list of the factors that are contributing to adverse childhood experiences. All of those which are in white are significantly higher among those individuals who are alcohol exposed. This is a lot of negative input to a child's life, and it involves substance use by the caregivers. It involves custody changes for the child. It involves incarceration, parental divorce, and violence and child abuse. So these factors were all experienced to a higher degree among the individuals who we surveyed if they were alcohol exposed in utero. There is a study, quite famous, looking at the relationship between these ACEs factors and later health outcomes. And these things are often predictive of problems with cardiovascular issues, diabetes, and so on. And if you have a score above 4 for ACEs, you are at much higher risk for having some of these negative outcomes. As you can see, the individuals who are alcohol affected report a much higher rate than do those in the control group. Another question we asked was, did you have health insurance? Because we wanted to know if that access to health care would contribute to these outcomes. And each group reported, about 90% of individuals reported they had access to health care, health insurance. However, those in the control group were much more likely to have private insurance, and those in the alcohol groups are much more likely to be reliant on Medicaid. However, about 20% reported not being able to obtain health care when they needed it in the last year. When we looked at these multiple influences on outcomes, I picked out several significant diagnostic outcomes, cancer, diabetes, and so on, to see how these things all fit together. And I did what's called a multinomial regression analysis, which allows me to look at the relative contribution of different factors on outcome. And I wanted to see if the prenatal alcohol exposure continued to be an important contributor, even when I included other factors. So you see, for cancer, prenatal alcohol and the age of the individual are the only things that really contribute to outcomes. When I looked at diabetes, prenatal alcohol exposure, female sex, SES, and age are contributing to outcomes. When I look at thyroid disorder, prenatal alcohol exposure, sex of the individual, biological sex, whether or not they had adverse childhood experience, all contributed negatively to having thyroid disorder. And when I look at kidney stones, we're finding that prenatal alcohol and the age of the individual are the major contributing factors. So what are the implications of these findings for the individual? And I find them sort of daunting myself. In terms of healthcare, these results suggest that alcohol exposure may have long-term association with a range of medical problems, and that this is something that when individuals are known to have this kind of exposure, their medical providers should screen for these problems. And they should screen for these problems earlier than they would tend to do so in other individuals. It also suggests that alcohol exposed individuals should have regular medical checkups, and medical providers should be aware that this is a significant risk factor for health outcomes. We speculate at this point that there may be some kind of premature aging going on among these individuals, but we don't know that that's the case at this time. That's a speculation. We are at this point negotiating to try to get follow-up funding in order to look into this more fully, but we have not got it as yet. Mental health problems are more common in alcohol-affected individuals, and these should definitely be, in fact, these were the most prominent things that came out, and these definitely should be the focus of screening in this group, and it should be done earlier in life than it is typically done. And another important question that arises from all this is, how do we prevent these long-term effects? Because we should not simply accept that this is inevitable. Certainly, there are some direct effects of prenatal alcohol exposure. They appear to have some outcomes that are directly associated with PAE. These obviously could have been prevented by abstinence and pregnancy. However, it's likely that knowing about the potential for negative physical and mental health impacts, that we could begin early intervention services to reduce the impact of these factors. I strongly believe that what we're talking about is something that has stressed the system early on and makes the individual vulnerable to the effects of stress later. And knowing that we should do everything we can to reduce the impact of these stressful factors on this individual who is more vulnerable. Some of the effects we see are indirect, and some are simply associated. And some of these consequences are due to conditions that are associated with maternal substance abuse, like negative childhood experiences. Obviously, we should try to prevent any child from having such experiences. But when a child is known to be alcohol exposed, attention to these associated factors could prevent or reduce these long-term outcomes. I strongly believe we need further research on this. These results are still preliminary, and they really strongly suggest some areas that should be studied more fully. We haven't studied long-term outcomes in adulthood systematically. Both medical and social emotional consequences need much more research, because we would like not just to describe these outcomes, but to understand the mechanism that produced them. And I suspect that we've been looking here at people who are 35, 40, 45 years old. I suspect that as people get into their 50s and 60s, these issues will be exacerbated with age. And there may be a question of accelerated aging in some systems that should be addressed. This is and I finally want to really caution you, this is an observational study. We're just looking at what people told us. It will be important to identify the biophysiological factors that contribute to these outcomes. And one of the things we're looking at and hope to see more, to understand better, is how the immune system might be entering into this. So I'll be happy to answer any questions. This is a lot of information I've threw at you all at once. And I would be happy to answer any questions or listen to things that you may have to offer.
Thank you so much, Dr. Coles. It's overwhelming. And as a parent, it's really frightening to see what may be in store for, our young adults. I have a 25 and a 29-year-old, and I can, a lot of this fits. So it will be, it's good to know about this, and I will encourage them to keep their doctors informed.